I'm Jenifer Detert. I'm a PA. I've been a PA for over 12 years, almost 13, but that's a bad word to say. Been at Midsota for almost 3 years. I have 2 years of primary care experience, 10 and a half years in the emergency room, 2 years overseas deployed to Iraq, and decided that the emergency room was just a little too hectic for me. So decided I need to do some hectic stuff and maybe some fun stuff where people are happy to see me rather than dreading me coming in to numb them up because they already hurt. So it's a good balance. I've been there for almost 3 years and it's a pretty good fit so far, I think. Why does your skin appear less useful, and why do we feel older than we feel? Why do we look older than we feel? There are internal causes and external causes. The internal causes are, as we get older, our muscles atrophy or get weaker. As those muscles get weaker, the skin becomes more lax. We actually lose muscle volume, so it's important to maintain your muscular strength by doing weight training as you get older so you can maintain your function. Well, the face does the same thing just like the arm muscles do. Bone loss. There's openings around the eyes, openings around the mouth, openings around the nose. You actually lose bone volume and those openings get bigger as we get older, so you lose bone. Therefore, you lose the foundation that your face is sitting on. So how do you replace that? Well, you either stretch the skin up into the positive direction against gravity that has been once pulling on it for 50 some odd years, or you add something underneath to stretch the skin out to give that appearance of youth again. Fat loss. So if you've seen everyone's faces when chubby, wonderful cheeks of little kids, well, as you get older, that fat either goes away because you have a lot of weight loss. People that are actually thinner look older as they get older. Chunkier people in their 50s and 60s look younger than people that are 50 and 60 and very thin. So good maintained weight is a good thing. But fat also migrates because of the decreased elasticity in the skin. And gravity, that fat, instead of being in our cheeks, is now sitting down towards our chin or up above our lips, and it looks like we have jowls or puppet lines in our face. Gravity. Not only does it take a hold of our face, it takes a hold of other regions further south. And genetics. Look at your mom, look at your dad, look at grandma, look at grandpa. What kind of lines do they have on their face? What do you not like about their appearance that they've let themselves go, or as they have not cared about anything? Wasn't not a priority, and you want to look as good as you feel. So genetics plays a big role in it. You know, if your mother looks like she's 40 when she's 60, well, you probably are going to look just as good. External causes. So there's things that happen to us that affect how we look. One, environmental factors. We're all bombarded by toxins and things in the air and things in our food and things that we eat. Those all age us. Sun damage, that's a big one in aging. You remember those people that look like leather and you're like, oh, they have a wonderful dark tan? Well, all that sun damage made them look prematurely old. Smoking. Smokers always look older than non-smokers. All that extra toxin. Weight loss, again, plumper people, healthier physiqued people look a little bit younger than those that are really thin. Illness. People that look sick just look a lot older than what they were previous to illness or even post-illness. Someone that has a heart attack looks really younger, before the heart attack. They have a heart attack, they're going through this medical illness, trying to get better, struggling to maintain their health. They look a lot older in a quite short period of time in comparison to someone that wasn't ill. People in the emergency room look a lot different than they do when they're not hurt and they're not feeling ill. And stress. Stress affects all of us, makes us age. So, we're going to look in our mirrors. The first thing you're going to do is you're going to look at your face, and we're going to look at those static lines. So static lines are lines or wrinkles, rhytids, are there at rest. So static means no movement. Those are the ones that are affected by fillers, because you're filling in those lines that aren't moving. Dynamic wrinkles are those that are deeper and appear deeper with movement. So we're going to talk about a few of those movements. Botox is primarily for the cheek and above, filler primarily the cheek and below. Now there's a few caveats. Have I done filler in the forehead? Yep. Have I done Botox around the mouth? Yep. So there's a few uses for each area. What is Botox? Botox is a purified toxin. How can it be purified? How can it be a toxin? How is a toxin pure? So botulism is an illness. The illness or the bacteria creates a toxin in your body. Your toxin, or the toxin, prevents muscle function. So from the bacteria, they've removed the toxin, made sure all the impurities, viruses, so if something's pure or purified, all the other types of toxin, there's A and B. So all that B toxin, it's back in chemistry. Remember chemistry when you were young and you forgot all of it? Just forget all of it. Type A is Botox. Type B is another form, which we're not going to talk about because we don't use it. Most common non-surgical rejuvenation technique. I say on average, I do probably 5 to 10 Botox a week, sometimes up to 20, 10 a day. I'm only there 2 days a week. So it's actually pretty common. Temporarily improves fine lines and dynamic rhytids. So if there's a line on your face and it gets deeper with the movement, it may improve with the Botox because you're not wrinkling that skin where that line is progressively going to get deeper. It's been FDA approved since 2002, so it's been around for 10 years. There are no documented medical side effects or complications of cosmetic Botox. Now you read in articles or if you do some research, Botox is used for medical reasons. So for spinal cord injuries, for spasticity or increase in spasms in legs, they have injected Botox. That's a significant increase in the number of units. When we talk about facial Botox or cosmetic Botox, especially on the face, we're talking anywhere between 20 and 50 units. When you're talking medical, you're talking 300 to 400 units of Botox. So it's a significant increase in the amount and where it's being used. We're using it on peripheral nerves, not on central nerves. So when you lose on central nerves or spinal cord nerves, there's more complications. So dynamic wrinkles are the target for Botox. So we're going to get our mirrors out again, and you're going to start by scowling. So scowl is you wrinkle your forehead like you're mad at someone or you're squinting. And what you're going to see is you're going to see a 1, you're going to see an 11, or you're going to see a 1,111 right in the middle of your forehead. That is the corrugator muscle or the glabella. That is where Botox is FDA approved and works the best. So if you see those lines when you scowl, remember what Grandma looks like. Those lines are permanent in Grandma's face. That's because over time, as those muscle structures contract, that skin gets deeper and deeper between those muscle structures. So not only is it a treatment to make you feel a little bit more rested, it prevents the need or perceived need for filler later on because those lines are only going to get deeper. They're only going to be a bigger job later on. Now we're going to do forehead wrinkles. So elevate your eyebrows, and then you can see all these horizontal lines across your face. Those you treat with caution. Reason being, if you think about it, your forehead keeps your eyebrows up over your eyes. So if you relax your forehead, so everyone do this test, look at the mirror, put your hand on your forehead, push down. And you look like you got a hood where your eyebrows are supposed to be over your eyes. So if you had some fullness in the skin above your eyes, didn't it just get worse? So you want to be careful how much Botox you have someone put in your forehead, because you might want to keep those lines, especially if you have bangs. Might not be worth it. Spend your money where you see it. Crow's feet. What was the peanut gallery comment? You're keeping your bangs. Crow's feet. So everyone smile or squint. You see those lines on the lateral eye? Honestly, I like those. That means we've been smiling. And maybe not squinting so much. So if you use your sunscreen or your sunglasses, they won't be as deep. You also, I call it the jelly roll. I'm not sure what someone else calls it. But if you smile, there's a little tether of the muscle underneath your eye. With that tether, you get a little roll of tissue. If you put a little Botox in that area, you get a lighter contour in the cheek. You don't get that jelly roll pouch underneath the eye. Faint wrinkling of the upper lip. So the upper lip is injected with caution. So you use the upper lip to speak, you use the upper lip to whistle, you use the upper lip to spit your toothpaste out in the morning. You actually use your upper lip to force air out to blow out a candle. There's lots of things you use the upper lip for. So you have to prove that you can handle 2 units of Botox in your upper lip. That's $20 to get rid of some of these lines, or $25 to get rid of some of these lines in your upper lip. Just because you have upper lip lines doesn't mean that you're a smoker. Yeah, again, look at grandma, grandpa, look at mom. Do they have these lines? A lot of these things are genetic. Upper lip. I've done up to 2 units in each spot, so 8 units in the upper lip, but you have to graduate. If you like the half a unit in each spot, then you get 1 unit. If you like that, then we talk about 1.5, and then we go, are you sure you don't want to talk like you got orals in your mouth? Because you can't move that upper lip and pronunciate as well. Down to the mouth. So, if you look at grandma and grandpa, do they look like they have a wooden puppet line? So that's the marionette line in the corner of the mouth. There's a muscle in the corner of the chin that tethers the corner of the mouth. If you treat that spot, the corner of the mouth will turn up, and you won't look like you're scowling all the time, or at least frowning. What are you mad about? Nothing, it's just my face. And we also use Botox for sweaty armpits. That's all I'm going to say about that. Why choose Botox? Well, it treats the dynamic wrinkles and helps prevent those lines from becoming deeper and static or not movable. Very little discomfort, minimal bruising, and no scarring. Office visit and initial consultation is about 30 to 45 minutes. That includes the first injection, if you want to. If you don't, you come back. Each injection or a next visit, if we are happy with the pattern and the amount is right, you come in, I'm like, I'm on a boots to Botox. 15, 20 minutes, you're out. That takes more time to do the paperwork, check in, make sure you got what you want, sign a consent again, than it takes for me to do the Botox. Of course, all those things are necessary evils. Results are not permanent, but they're reproducible if the documentation is completed to see how much was placed in which muscle in what area. It's reproducible. Results are expected to last 4 to 6 months. Again, everyone varies. Some people, their metabolism is higher, it doesn't last quite as long. Some people, you come back 9 months later, like, when's the last time we did it? 9 months ago? Looks like it was only 4 months ago. Everybody's different, so it affects each person differently. We do a rate-check appointment after your first injection. That is to evaluate the pattern that was chosen, to see if you decided on any other areas you want to try, and to make sure that you're happy with the results and I'm happy with the results, to make sure that what we decided to do had the desired effect. If it was undesired effect, I'd want to document it. And most people don't remember what they look like 2 weeks after injection the next time they come. So it's really important to get that follow-up to make sure you're happy and I'm happy and we don't need to add more, or maybe I put too much in, which is rare because I'd rather undertreat than overtreat. Because you can't take it out, but you can put a little bit more in to even things out. So what to expect? Tiny series injections in treatment area. We'll talk about a few treatments areas shortly. Slight discomfort, redness, spotting, maybe bruising, and a little bit of bleeding. I try to miss those blood vessels, but we all have a bunch of blood vessels right in the middle of our forehead. We all have a bunch of little blood vessels around our eyes. I do try to miss those. If we did get one, you put an ice pack on it, you put pressure on it, you go, you're going to bruise here, hold a little pressure to make sure it's the smallest we can make it. If you let it go and you walk out the door, you'll have a big black eye. So it's best to just be upfront. If you bruise, you bruise. It's a risk. Sorry, gotcha. Woohoo. Find a good story. You got hit in the eye with the door. Think of something really quick. We tell people that you can go on your normal activities. Some people come in over their lunch break, about 11:30, we do Botox, they go right back to work. Nobody knows. Of course, I do take your makeup off. So you might want to bring a little touch-up blush or powder to put on, because you might get a little pink, you might be a little red because I squeeze. We'll talk about that later. You want to avoid any pressure or massage in the area. You don't want to go put on the baseball cap. You don't want to go put on the bike helmet, because pressure where the Botox was injected within the first 4 hours, that Botox may go into the upper eyelid, and then you'll have difficulty opening your eye. Yeah, so there's a few things you don't want to do. Results usually occur in about 3 to 14 days. If you look at your brochure on Botox, they have a initial, a day 2, and a day 14. I think that day 2 might be a little early. I'm going to say that's probably more like day 4, day 5, but they published it as day 2. Some people notice a little bit of change around day 4. Full effect in about 2 to 3 weeks. We tell people to, again, come back that 2 to 3 week time period, make sure the Botox is set up, it's going to do what it's going to do. We can do a touch-up. We can evaluate or document the change, positive, negative, do adjustments that's going to last essentially the same cycle. Make sense? So this is a female that I did a scowl treatment on. We anti-scowled her. So there's a few faint lines here. It's a little deeper. She doesn't like them. Her grandmother has them. They're really deep. So this is before. After 2 weeks. 14, 17 days later, she's actually scowling in this picture. It's not that she's just standing there straight face. She's trying to scowl. This is what her result was, 21 units. So this is an example of where those injections are. So you talk about the glabella or that scowl line. I also like to do a couple small ones, medial and lateral brow, to kind of help lift up the brow to open up the eye a bit. This is 22 units. This is before. This is maybe 3 weeks later. She's trying to scowl and she got a tan. So this is the glabella. So I injected the glabella, which is the 11 muscle, and a little bit in the forehead. This is on the 31st of January. This is on the 14th of February. She's trying to elevate her eyebrows. Same person, lateral eye. So she's squinting or smiling. You see those little crow's feet? If they're this superficial, Botox can do quite a bit. If they're a lot deeper, then you don't want to put too much in them, because then you're catching the muscle that helps you smile or pull up the corner of the mouth. Then you're kind of behind the 8 ball. So if they're like this, you can put 9 units on each side of the eye. Of course, I injected the other eye. After. She is smiling again. See the improvement? Here you can see 1, 2, 3, 4 lines. Maybe you can see 2 small ones. I wouldn't do more. Upper lip and down to the mouth. This is 7 units of Botox. That's all I've done to this person. She didn't want anything else around her mouth. She didn't want fillers. She didn't want to look like she had plunger lips. She didn't want sausage lips. She didn't want hot dogs, tops and bottoms, which I won't do. If you want that, go to New York. Anyways, before. So I did 2 units, so half a unit on each of these spots that I have marked. 1, 2, 3, 4. 2.5 units in each of the corner. All I did was a little Botox. So 7 times 12. Doesn't last quite as long around the mouth because we move it more. So you move those muscles more, so it tends to burn off a little faster. So you might need this every 3 to 4 months instead of 4 to 6 months. Or if you don't talk much, it might last a little longer. But the more you talk, the more you drink, the more you chew, the quicker it goes away. Temporary fillers. So we have 2 types of fillers that we use at Midsota, temporary and semi-permanent. I'm going to talk about the difference in the 2 types we use. First one, Juvederm and Juvederm Ultra, Ultra Plus. It's a non-surgical, again, rejuvenation procedure. Fills in fine or deeper lines. So these are those static lines that you see that may get worse with movement, but they're just there. You move them, they get worse, but they're just there. Or you notice you have an area that you're losing volume, like the upper lip. Your upper lip gets elongated as you get older, and it turns in. So the fact that you're losing your upper lip is not a figment of your imagination. It happens. The fact that you're getting deeper in the corner of the mouth, well, the cheeks are going to go somewhere. They're migrating south. So you're getting new lines in areas you don't remember them. Those chubby cheeks you had when you were little, someone commented on, where did they go? They're gone. They migrated south too. So Juvederm is one of the products that can help some of these changes. It's a hyaluronic acid. Hyaluronic acid is a water-loving molecule. It is found normally in your connective tissue. So we're putting something in that you already have. It is found to promote some collagen production, not as much as the other product we have, but it helps you make your own collagen. So it helps you improve the elasticity and the fullness of your skin. No allergy testing needed. When they used to do the collagen injections, you had to get an allergy test to see if you were going to be allergic to it, and then they'd inject you. Well, these are all hypoallergenic, and I have not seen anyone with an allergy in the 3 years I've been injecting. FDA approved since 2004, so we use something that was approved in 2002 and 2004. We use the old things. Let someone else try all those new things and find all the problems with them, and we'll just use the old standards that have been around a little longer. Then you're better at them if you don't have a lot of choices, because you use two products. Dermal Fillers developed Midsota. Again, we have Juvederm Ultra and Ultra Plus. They come in two sizes, 0.4 and 0.8. Ultra is a little bit, okay, back to chemistry, sorry, less molecular bonds. So it's a little bit softer, it goes away faster, not as structured. Ultra Plus has a few more structures to it, so it's a little bit thicker. I can't tell in the syringe, but microscopically it's a little bit stronger bonding, so it sticks around a little bit longer. The makers are getting smarter. They're putting extra comfort or lidocaine in all these. Well, we put lidocaine in them already, but they don't charge us anymore for putting lidocaine in it before we get it. So, extra comfort contains lidocaine. Again, lidocaine can be mixed into any syringe of filler. It's found that the lidocaine does not change the chemical compound of the filler, just makes it a little less viscous. So, a little more like water rather than toothpaste. It's a little hard to inject toothpaste, so it thins it out a little bit so it's easier to manipulate. And it feels better. Semi-permanent fillers. So temporary was the 6 to 12 months, goes away. Semi-permanent, it's around a little bit longer, 18 months to 2 years, and it's called an implant. So it's a calcium suspended in a gel. The gel dissipates, and your body actually does promote collagen with the radius injections. So I found that people don't need as much radius when they come back in 18 months to 2 years because they've produced some of their own collagen. No allergy testing. This one's been around since 2006. 2002, 2004, 2006. You hear about all these new products, new filler, there's a new filler, there's a new Botox, there's a new neurotoxin. Let someone else have 15 different products they want to offer you. We have 3. The reason we have 3 is so we can do 3 well. You know what you're injecting, you know how it acts, you know what depth to put it in. We have 3 because we want to do a good job and it's your face. Radius, so it's a sterile injectable implant suspended in a gel, thank goodness, otherwise it's really hard to put in a needle. Otherwise you're doing an implant surgically. We have 3, 0.3, 0.8, and 1.5, so it depends on how much volume needed in any one area. If you have a divot in your nose you just don't like, 0.3 is adequate to fix that divot in your nose. And I've done it on a few. Works pretty good. It's around for 2 years. It's better than having no surgery. That may or may not heal in 6 to 9 months because of the swelling. Average results, again, 18 to 24 months with this. Results usually soften about 2 to 3 months. So as that gel goes away or dissipates or gets dry, I'm not sure exactly what it does, when it produces your own collagen, the filler gets softer. Again, lidocaine is almost always mixed with the radius, in my opinion, because again, it's easier to inject milk rather than toothpaste in a small needle. So, what areas are affected by filler? Again, those static lines are the ones that don't move. And these are some of the common areas. The glabellar, that deep line in the middle of the forehead. Fullness or loss of volume in the lateral brow. Temple. Got to be careful of those blood vessels. Ear. Your earlobe gets less volume. Upper lip, around the mouth. Nasolabial fold, which is that line between your nose and your lip. Marionette line, that line between your chin and your corner of your mouth, and cheeks, and tear troughs underneath the eye. So nasolabial fold, again, that spot between your nose and your lip. Lips, as you know, as we discussed, your upper lip gets elongated and the upper lip gets thinner as we get older. The lips also turn inward as you get older, so they look finer and more delicate. Marionette lines, the corner of your mouth to your chin, where we can do a little bit of Botox, but if it's not helpful or the line is too deep, then filler would be more appropriate. Cheeks, that volume that you had when you were younger that's now sitting in the nasolabial fold or in the marionette line. Sometimes you come in and like, I don't like this line in my nasolabial and here. Like, well, everybody look in your mirror and squeeze your cheek. See what happens to those lines. Those lines get softer. So if you squeeze your cheek, you're putting fullness where you lost it, so your lines get softer. So do you really put the filler where the line is, or do you put the filler where you once had volume that you've now lost and it's gone south? Tear trough underneath the eye, where people look really hollowed out, that's because of that bone loss as we get older. Earlobes, haven't done this yet, but nasal contouring, if you have a divot in your nose or you have a ski slope bump and you're like, I want to get rid of that, but I don't want to go underneath the knife. And I would like something that's going to last a couple years, and maybe I'll touch it up if I like it. A little bit of filler. Deep scowl lines. I tell people to try Botox for at least a couple of years before you inject that, because it's cheaper, easier, reproducible. And then full facial volume. It means you add volume where things are gaunt or thin. Mostly the cheeks, the chin, the temples, where people have lost weight or volume from muscle loss. I have an example of that also. Again, this is treatment of static wrinkles, rhytids, and deep creases. Replaces volume and corrects asymmetry on some people. I had a lovely lady, unfortunately about 15 years ago, she went for a bike ride. It was a little cold. And because of the cold weather injury, which I believe what happened, she had decreased function, well, maintained function, but decreased volume on just that one side of her face. I think she got a deep frostbite. She actually went to the hospital and she got evaluated for strokes and MRIs and this and that. I'm like, well, you had a cold weather injury. So she lost volume or fat. So you think about now they're doing cold fat treatment. Well, it's exactly what she did to her face unintentionally. Because that you put cold on, you lose fat. In theory, it's probably an old theory, but it's a new again. But she lost volume. And she goes, well, my daughter's getting married in 2 years. I want my face to look similar to the other side of my face. So we just injected one side. She liked the one side. She wanted it to match. So it's kind of unique, but it's a good story. Bruising is expected. So when you put the filler in, it's more of a feathering technique. So you're going to catch a lot more blood vessels than you are with a simple small injection of the Botox. So bruising is not common. It's expected. So it doesn't commonly happen. Expect it to happen. Office visits, initially 45 to 60 minutes. Now because of all the contours in the face and how much time, this doesn't include the injection. This is just talking about what your goals are, what product is appropriate for what your concerns are, to make sure you've made the right choice, you have the appropriate expectations for the product that's chosen. Make sure you're ready. It's your face. It is how you present yourself. 80% of what we say does not come out of our mouth. It comes out of facial expression. And you're asking someone you just met to augment your facial expression, augment who you are. I want you to, it tugs at my heart, makes me nervous when someone goes, I just met you, change my face. I'm like, wait a minute, are you sure? So it kind of makes me a little nervous when people do that. Now it's maybe because they've had it 3 or 4 times before and they know what they want and they're comfortable. Yeah, so it's always best to get just have a conversation, make sure you know what it costs, what's the benefit, what are the expectations, Make sure you're on the same page and we're not wasting your time, your money, and you have the right goals. Results, again, are not permanent, but they are reproducible. Results are expected to last 2 months to 2 years, depending on the product used and location used. Again, better to undertreat than overtreat. The radius cannot be taken out, cannot be removed. Nothing can happen to it, except it will dissolve over time. The only way it can be removed is if you get it surgically excised with a scalpel. There's no removal of the radius. The Juvederm, there is a product called hyaluronidase, which will dissolve the Juvederm. So if you're not happy with that, we can dissolve it, but that's a really tough thing to do. We don't charge you to dissolve it, but you really had to pay for it to get it in. Now, fortunately, I've never done that to any person that I've injected. Not to say we haven't done it, but any person that we've injected at Midsota, we have not used it, but we do have it available because you just never know. Preparation. So before you come, avoid those aspirins and those medications that increase your risk of bleeding. If you are on Coumadin or blood thinner, it's more important that your heart is not going to clot, especially if atrial fibrillation where your heart doesn't pump correctly. It's more important to thin your blood than it is to worry about bruising. We'll do some other things to minimize the bruising. Take your Coumadin. Take your Plavix. Take your aspirin if you have to. We'll manage. Bruising's more reasonable to overcome than a life-threatening injury because you didn't take a medicine. Avoid herbal teas or supplements. You'd be surprised how many things are in teas that cause you to bleed. Vitamin K is something we give topically to help stabilize the platelets so you're less apt to bleed. It's not to say you won't, but you're less apt to bleed. And that can be done at your consultation appointment, so we can say, hey, take this for 2 weeks, put this on your face just locally where you want injected, and your bruising will be less. Makeup. I take it off because I don't want to create an infection, and makeup's not sterile. So I use a lot of alcohol and a lot of 4x4s to clean the makeup off. So you can put a little bit back on as long as it's your normal skin tone, but I will be taking your makeup off, so don't put it on in the morning. Plan accordingly for social events for that bruising, for your touch-up. Minimum of 2 weeks of bruising. Everybody's different. Some people bruise a little bit and they have one little spot. I had one lady, we did her nasolabial fold, her marionette line, and she goes, I look like a pug. I'm sorry. She had a really dark bruise. At least she was prepared for it. She got better in a couple weeks. I didn't see the bruising when she came back for her touch-up appointment 2 to 3 weeks later, but she felt she looked like a pug. You know, the dogs with the really dark muzzles. Mm-hmm. Pain management. Got a second, Ruth? So there's a few things we do to help manage pain. One is we use local anesthetics. So we mix the lidocaine with the filler. We do a regional nerve block. So if you do your lip, we do a ring block or an infraorbital block or a submental block. Now those are big words, but we block the nerve so it doesn't hurt as much. If you're comfortable, I'm more comfortable doing the injection. If you're not scurrying away from me in the chair, I can tell where I'm injecting it. I'm more comfortable, so you're going to have a better result. So it's more for me than for you. XC, which is lidocaine extra comfort, aesthetic mixed with the topical. Topical anesthetic, a little derm vibrator that vibrates the nerves, and ice. So if you think about it, you feel hot, cold, vibration, pressure, and pain. So if it's cold, you're not going to feel the pain. If it's vibrating, you're not going to feel the pain. If you feel pressure, you're not going to feel the pain quite as much. So what to expect at a filler visit? A series of injections in the targeted treatment area. Initially, you notice some swelling, some firmness of inflammation. That's because of the trauma. I mean, there's trauma, there's work involved with putting in the filler. So you're going to swell, it's going to be a little firm. Usually that trauma or that injury from the injection and the feathering in gets better in about 72 hours. Bruising, up to 2 to 3 weeks, depending on if you've not taken any aspirin, not taking any ibuprofen, skipped your teas for a few days, used the vitamin K. We can give you some things to prevent bruising so it's not as significant. Usually you can cover it up after about 3 to 5 days depending on the level of bruising. A good tattoo makeup will cover it up if it's bad, but that's why you want to plan accordingly. Downtime, again, you can go about your normal activity. There are a few people that come in and I inject their nasolabial fold, they go right back to work. Just depends on the area, depends on what you do depends on if you can sit in an office, but usually the bruising is noticed 2 or 3 days later. You don't see the bruising right away a lot. It's bad anyways. Avoid exposure to the sun or heat for the first 24 hours. That's just because the Juvederm is a water-loving molecule, so if you dry it out, it tends to not set up quite as well. But if you hydrate, it'll plump right back up again. I want you to massage the area. It decreases the complications of the filler. If you think about putting something into the face or the soft tissue, if you have an area that happens to be pinching a nerve or pinching a blood vessel, it's important to massage that area with some external pressure. So actually massage is a way of decreasing the complication risks. What are the complications of filler? Numbness. Unfortunately, some fillers, if you put it in the wrong spot, you can actually occlude a blood vessel and get an area where the skin does not live. So you have sloughing of the skin if it's placed incorrectly. If it's placed too superficially, you can see the filler. So if you put the Juvederm too superficially, it has a refraction color of blue. So if you put it here underneath your eyes and you put it too superficial, it looks like you have black eyes. If you put the radius too superficially in the skin, that calcium will sit on the surface and it looks like you have a bunch of whiteheads. Well, those will need to be excised because there's no good blood flow to get rid of the gel and get rid of the calcium over time. That'll need to be excised. So it's important you put it at the correct depth and you use the filler in the correct location because there are complications. Fortunately, I haven't had to personally witness any of those, thank goodness, but they are out there. Unfortunately, in Minnesota, you don't have to have a license to do fillers. So if an MD believes that a LPN, licensed practical nurse, people that give out meds in the nursing home, they believe that they have the knowledge to do fillers, they can in the state of Minnesota. If an esthetician, if a doctor feels an esthetician has enough knowledge to inject fillers in the state of Minnesota, they can. A lot of RNs have lots of good medical knowledge and are injecting in the state of Minnesota. Midsota is quite a bit conservative, and so is the St. Cloud area. Therefore, you have a master's degree physician assistant injecting or the surgeons injecting. We don't have RNs or LPNs injecting at Midsota. Facial structures, nerves, blood vessels are too important to miss. Complications are your face. It's your face. So yeah, you can get it less somewhere else. You might like the result, might be great, depends on the injector, depends on their knowledge of the anatomy, nerves, blood vessels, function, their understanding of the product they're using. Sure, you can always get it cheaper. Food for thought. Anyways, recheck 2 to 3 weeks after every filler treatment. That's to ensure that I didn't create any complications, because if I create a complication, I want to know, because I want to fix it. I want to fix it. I want to know what's wrong. I want to fix it, whether it's an asymmetry, something doesn't feel right, something doesn't look right. I want to know what it is because I want to make it better. Touch-ups, obviously touch-ups are important. One thing I do like to do is if you purchase a 0.8 cc syringe of filler, I like to save about 1/3 of it, or maybe even 1/4 of it for your touch-up appointment. Because I don't want you to have to purchase another syringe to make things symmetric, because you're going to swell, you're going to have bruising, and those things are going to throw off the symmetry. And I inject one side at a time, so you can see the result on one side and say, oh, that looks a lot different from the other side. Okay, we'll do the other side to match. I try to save a little bit, so if there is a remaining asymmetry after the inflammation, the swelling, the bruising, when all of that goes down, I want to have something that you've already purchased to make that fix. So this is an example of Juvederm Ultra Plus. Now if you look in your Juvederm brochure, there's wonderful pictures in there. They're using 2 or 3 syringes to make those changes. When I say one syringe, there's only half a syringe on each side of the face. So I'm using half the volumes than they are in the brochure. Granted, they're pretty significant results, but it's twice the cost, twice the risk, twice the volume. So you're going to get twice the benefit, improvement, maybe. But we're in Minnesota, it's conservative. So less is more. Can always add more. Can't take it out. So this is Juvederm Ultra Plus. It's 0.8 cc's. And we treated her nasolabial fold. This is the corner of the nose down to the corner of the mouth. This was September of 2011. After, about a month later, this is just half a syringe on this side. The other half of the syringe was used on the other side. So this is a half a syringe of filler on this side of the face. This is radiese, similar area. I'm comfortable doing either Juvederm or radiese around the corner of the mouth. Juvederm is softer, so if you've never had fillers before, start with something that's temporary or more temporary. I can remove, not as big of a risk, so to say. If it's something that you seem comfortable with, you've had it before, then sometimes I push people towards the longer acting. It lasts twice as long, the radiese. So I'm comfortable doing either or, especially up in the corner towards the nose, because we've lost bone there. So you should put bone where you've lost bone, which is the radiese. After 21st, this is 1 syringe of radiese, not 2 or 3 syringes of radiese, which are in your brochure. Juvederm Ultra Plus. Again, this is a 0.8 cc. This has the extra comfort in it. She was a little nervous about getting injected. Topical, some ice, extra comfort. This is 1 cc. This is before, after. So that's half a syringe on that side of her face. This is cheek augmentation. If you look here, you see the profile, pretty flat from the front of the eye to the anterior chin. So pretty flat. Again, this is the other profile, pretty flat. I did 1 syringe of radiese and 1 syringe of Juvederm, mostly because she wanted some softer things around the lip, some softer things around the chin. You want the radiese deeper to replace volume. The Juvederm's more superficial to replace or kind of soften those fine lines that you shouldn't put Botox in because you need to move your mouth. After, subtle, but you see that cheek profile is more pronounced and this cheek profile is more pronounced. Imagine how much volume changed here, changed the overall shape of her face and the look of her face as far as aging. You don't want a square, you don't want full foremouth. Monkeys have full foremouths, humans have structure. Cheekbones, cheeks, high cheeks. So if you want to fix lines here, you don't necessarily put everything there. This is a lip augmentation. This is half a syringe of Juvederm. So this is half of that 0.88 that they're talking about in the brochure. They're talking about using 2 or 3. I use half of one of those and a little Botox. And she came back for a touch-up because she got married. And this is after her touch-up. So, not quite a year later. Lovely, beautiful young lady. Wanted fuller lips. Angelina Jolie, I think she said. I'm like, okay. You look beautiful. You don't need any of it, but okay. 0.8. I did use some of it in other places because it wasn't. Not sausage lips. You don't have lips in the corner of your mouth. So if someone's putting filler on the corner of your mouth, it's supposed to come to a point. It's not supposed to come to a fat. It doesn't look like a plunger. So really it's about how you inject and what it looks like. She was ecstatic. I expect to see her back pretty soon because it's about a year. Nose. So this woman has a divot in her nose because she had a biopsy and she hates it. Now, we all have these things on our face that we can see but no one else can see. Well, if it's bothering you, it's for you, it's not for anyone else. So she hated this divot in her nose. Okay. 0.4 of radiese. Smallest one I could get, and I don't think I used it all. Immediately after. So I didn't make her come back. I'm like, can we do a picture right now? So I injected her, and then Ruth took a picture. Immediately after. It's not a big change, but she was happy with it. So subtle. I haven't seen her back, so I assume she's good, except for Botox. Oh, this lovely lady. She's hilarious. She's 74. Like, no, I don't want to put any filler in your face. Absolutely not. Why would you want that? She convinced me. She said, you know, about 5 years ago, these ladies in church, they had this Restylane put in, and they looked so much younger, and I vowed I was going to get that. I'm like, well, we don't have that, but we have Radies, and we have Juvederm. I said, why do you want to do this? I'm like, I'm tired of my whiskers right here, you know, the little cheek whiskers. I'm tired of my kitty whiskers. And where are my lips? Where are my lips? She's tired of her lipstick going up towards her nose. Okay. So I did it. I used 1 syringe of Radies and 2 syringes of Juvederm just because of all the softer lines. And she doesn't need any more volume. No. She's got lovely apples of her cheeks. This is after. She was ecstatic. Can I have more? No. No. Come and see me in about a year. I haven't seen her yet. But I said, well, why do you want to do it now? And she goes, well, I've been taking care of my husband. And he recently passed away, and I didn't think it was nice to look good, and this is what I want to do for me. Okay. You just don't argue. I didn't argue. No. Optimal results, non-surgical rejuvenation. Results obtained with a combination of treatments and products to include aesthetics for your skin tone. Botox soften wrinkles that deepens with movement, prevent deeper wrinkles. Fillers correct static wrinkles, restore lost volume, and correct facial asymmetries. Good skin care from the estheticians at the Midsota Skin and Laser Center. Woohoo! I like them. This is Sharon, one of our lovely nurses. This was in 2005 when she started. I think she was angry. I'm not sure. It was a bad day. She was going to be here today. I think she's chickened out on a reason. This was right before we went to the cities for an injection training that I was going to. She was my guinea pig, literally right before. Ruth, you got to take Sharon's picture before I'm taking her. She's not getting in the car until she takes her pictures. And then she ran out to my car. This was 2 weeks after. So I did Botox, a heck of a lot. I can do as much as I want when I take them there. I get 40 or 50 units. Of course, she's not smiling or anything. She can't tell. Radies and Juvederm. I plumped her lips, put some in her nasolabial area and her cheeks. You see she's a little bruised. And Botox in her forehead. So this is what I mean by full face volumization. So cheeks, lips, kind of putting the volume where it once was. That's Botox. Mm-hmm. So, treatment expectations. Treatment plans are tailored to your individual concerns and needs. Repeat treatments and touch-ups unfortunately are required to maintain the desired results and appearance. Understanding treatment options is important. Realistic expectations of both myself and the products chosen. Product longevity. Some people it lasts 6 months, 2 months, again 2 years, 6 months, 2 years. Botox 8 weeks, 2 months, 7 months. Everybody's different. Plan ahead for swelling, bruising, which are normal and expected after injections. Obviously filler more pronounced than Botox. Botox must be taken before all initial Botox and preferably 2 to 3 weeks later so we can kind of make sure your treatment plan is appropriate and accurate. If not, well, I'll ask you, did you like it? Do you remember? If you don't know, I don't know. So we'll do it again and say, well, let me know if you don't like it because then I can document it. Otherwise, I don't know. I tell people that almost all dermal filler injections, I would appreciate appointment before because if you have a complication, I want to know about it. I want to be able to compare it because a picture's worth 1,000 words. Unfortunately, some people come in and go, my eyebrow's drooping on this side. And I look at them like, I didn't put any Botox in your forehead or in the muscle above your eyebrow, so I'm not sure I did that. So you look at the picture, I'm like, yeah, you were droopy before, but it's better than it was. So again, recheck 2 to 3 weeks is requested to document results and discuss touch-ups as needed. We are fortunate to be a Black Diamond certified group by Allergan. Allergan is who gives us the Botox, the Juvederm, and the Latisse. Allergan is best known for those products. Midsota Plastic Surgery is the only provider in the St. Cloud area to have this award. So, by Allergan, 2 leaders in the field of medical aesthetics, and demonstrates their commitment to innovation, excellence, and highest level of patient care. So the reason why we have that. I just have to brag about everyone. Goal, radiant, youthful skin regardless of your age. I still want you to look your age, but I want you to feel good about your age.